In this video, we are going to see radiological anatomy of carpal bones, and we'll see the ossification centers to look at pediatrics X-rays. So let's begin with naming the carpal bones. So there are two rows of carpal bones. One is the proximal row containing scaphoid, lunate, triquetrum and pisiform bone, and the distal row contains trapezium, trapezoid, capitate and hamate. So everybody knows the mnemonic. She looks too pretty, try to catch her. Now we will see the same in X-ray. This is the distal end of radius, distal end of ulna. This is the scaphoid bone, the lunate, triquetrum and pisiform, which is a sesamoid bone which is placed over the triquetrum. The second or the distal row contains trapezium, trapezoid overlapping it, the capitate and the hamate bone. Repeating, this is scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate and hamate. This was the AP view. Now we'll try to localize the same bones on lateral X-ray. So this is the distal end of radius, distal end of ulna. This duck-shaped bone is scaphoid. Next is the half-moon shaped bone called lunate, as the name suggests, lunar shaped. This is triquetrum and pisiform. Coming to distal row, we have trapezium, trapezoid, capitate and the hamate bone here. In order to assess the integrity of these bones and intervening ligaments on PA radiograph, we use Gilula 3 carpal arcs. The first arc is drawn along proximal convexity of scaphoid, lunate and triquetrum bones. These are the proximal row bones. Second arc is drawn along distal convexities of the same bones, scaphoid, lunate and triquetrum. And the third arc is drawn along proximal convexity of distal row bones, that is capitate and hamate. Any disruption or step off in these contour of these carpal arcs will represent ligament injury or displacement of carpal bones or even fracture. Coming to ossification centers of wrist joint, the capitate ossifies at 1 to 3 months, hamate at 2 to 4 months, triquetrum bones at 2 to 3 years, lunate at 2 to 4 years, scaphoid bone at 4 to 6 years, trapezium also at 4 to 6 years and trapezoid bone also at 4 to 6 years. The pisiform ossifies late in life, that is 8 to 12 years. Distal end of radius is ossified at 1 year and distal end of ulna is ossified at 5 to 6 years. So if we notice, the ossification starts from capitate, goes clockwise up till the trapezoid bone. Revising the ossification centers, let's go clockwise from capitate, 1 to 3 months, hamate 2 to 4 months, triquetrum 2 to 3 years, lunate 2 to 4 years, scaphoid, trapezoid, trapezium at 4 to 6 years. Thanks for watching and follow our page on Instagram and YouTube for more such videos.